Hello and welcome. I'm Dr. Mark Solkowski. I'm a professor of medicine at Johns Hopkins University, and I'm the chief of the Infectious Disease Division at Johns Hopkins Bayview Medical Center. I'll tell you a little bit more about Johns Hopkins Bayview, the hospital, and a little bit more about myself. Uh, Let me start with myself. So I've been at Hopkins since 1995 when I came to do a fellowship. My fellowship in infectious diseases ended in 98, and I came on faculty as an assistant professor. My career is focused on clinical research related to viral hepatitis C and spent a lot of time helping to change the paradigm for how we treat that important infection with direct antivirals. That was a heck of a lot of fun and a great place to be part of that at Johns Hopkins, where we have a wonderful team that really has covered hepatitis C from literally bench to bedside and now to the world with elimination of hepatitis C as a project. More recently, in October of 2019, I took over as the chief of infectious diseases at the Bayview Medical Center. And working with my colleague, Dr. David Thomas, and our clinical director, Dr. Paul Atwater, to ensure that we function as one integrated unit, uh, highlighting some of the really important things that the Bayview Hospital brings to the medical center. So let me then move on to talk about Johns Hopkins Bayview. So our clinical faculty and our infectious diseases fellows provide consultative service at both Johns Hopkins Hospital as well as Johns Hopkins Bayview Medical Center. So rotations for the consult service include both hospitals. Our faculty go back and forth, although we do have a dedicated faculty that has office space and research facilities at Johns Hopkins Bayview, where I'm sitting now. Let me tell you a little bit how Bayview fits into our health system. The Johns Hopkins Health System is actually six hospitals. There's uh, three community hospitals in the Baltimore, Washington area, and there are two academic hospitals, Johns Hopkins Bayview and Johns Hopkins Hospital. They're located about 2.5 miles apart. So really close. You can get back and forth in about 5 minutes, well, maybe 10 minutes. So these the hospital at Bayview is a little bit different. It's about 450 to 460 beds, and it is what I would describe as a community academic hospital. We absolutely have an academic focus and are fully integrated in the academic mission of the institution. But we also have a community center. Bayview actually dates back to 1774 as one of the oldest continuous hospitals in the East Coast of the US. And it's always had a really important place in the Baltimore community. It was the Baltimore City Hospital until 1984 when Johns Hopkins took over the hospital. And since then, there's just been a continuous changes to how the hospital functions. But what we haven't lost is the community focus. And the community around Bayview is really quite interesting, both from a cultural perspective, but also from an infectious disease perspective. This is an area which has historically been the home of immigrants to the United States. Uh, 100 years ago, it was people from Germany and Ireland, and also Greece. More recently, it's been people from Latin America, and the Latinx community is really well represented in the Johns Hopkins Bayview population of patients we care for. And that's had really important implications for our health system. We've had an emphasis on caring for this group of people with the Centre de Sol, which is led by Kathleen Page at one of the ID doctors. And during the COVID-19 epidemic, one of the things that we noticed in our health system is that our Spanish speaking Latinx population has had very high rates of COVID 19 and been disproportionately affected in our community. And Bayview has really led the charge of how we take care of this population within our health system. And there's been a real important emphasis. So what I want to present with that scenario is just how Bayview is a place of innovation. The entire health system was grappling with COVID-19 in the Latinx community, but it was Bayview that led the adjustment of how we dealt with that as a health system. Similarly, there are other academic programs that are rooted here. For example, geriatric medicine is based at Johns Hopkins Bayview, and it's the #1 program in the United States. Really a strong emphasis on healthy aging, both from biology and clinical perspective. It's also the home of our focus on substance use disorder. And there's a real emphasis on this intersection of infectious diseases and substance use disorder. So there are some really innovative programs, like the Comprehensive Care Clinic, that deals with wraparound services. And our OPAT program, led by Jenny Townsend, has really been innovative in linking opiate agonist therapy to parenteral antibiotics, both in skilled nursing facilities and increasingly finding other avenues where we can optimize the opportunity for success in our OPAT program by treating both substance use disorder as well as the infection. So another area where Bayview has been highly innovative, but is perhaps best well known for its contributions to what I'll describe as clinical excellence. Johns Hopkins is a major research institution, and the science that comes from our university is really amazing. But there's also fantastic clinicians. And the Miller Colson Academy emerged at Johns Hopkins Bayview about 10 years ago. And this really became an academy to focus on clinical excellence. And this has actually paved the pathway for the School of Medicine to have a promotions pathway based on clinical excellence as well as scholarship. And that change just took place over the last year. But the roots of the focus on clinical excellence really is at Johns Hopkins Bayview Medical Center and became the roadmap the entire school followed. We've also got a strong emphasis on education, which leads me to talk about the residency program here. So most of our divisions and specialty training have essentially one academic division. So infectious diseases, for example, we span both hospitals with one set of fellows. That is true of other residencies as well. They have one residency program, spans both hospitals. Internal medicine is a little bit different. There is an internal medicine program that's located at the Johns Hopkins Hospital, and a second program that's located at Johns Hopkins Bayview Medical Center. The program director for the Bayview program is Erica Johnson. Erica is an ID faculty member based at Bayview with a really strong basis on education. And the residency program Bayview is really focused on training what I'll describe as the complete physician. So they focus on clinical excellence, on education, and there's a real strong push for primary care as well. A wonderful program led by Erica, and then Khalil Ghanem, who's in the division with a home at Bayview, is also heavily involved in the education program on our campus, including Medicine Grand Round. So a real strong emphasis on education as well, coming from Johns Hopkins Bayview. And I think the final point that I wanted to touch on is sexually transmitted infections. This is an area where our Johns Hopkins faculty, led by Jonathan Zendelman and Ann Rapallo, have had a major role in STI research and treatment prevention over the last several decades. Ann Rapallo has been the principal investigator of the STD HIV Prevention Training Center, which operates out of the Bayview campus. So a lot here, and a lot that really complements what we have at Johns Hopkins Hospital. Again, the emphasis being on substance use disorder, geriatrics, education, and clinical excellence. Now, I mentioned I've been here about 6 months. I had a plan for the first 6 months of how we wanted to shape our program, and well, COVID-19 came along, and it hasn't gone exactly as planned. But part of what we're doing is really reinvigorating our clinical service with faculty member Dr. Bill Wright joining us, who is running our clinical service along with our colleagues at Johns Hopkins Hospital. And Mamuka Machade has taken on a role as for the fellowship at Bayview as well. So a lot of energy, a lot going on in both the clinical service as well as the fellowship training, which reminds me, I forgot to mention one of our other crown jewels of Bayview, which is the Regional Burn Center. Uh, it's a place where infectious diseases can interact with really a world-class burn center. Lots of opportunities for clinical care as well as research. So I'm trying to give you a snapshot of what Bayview brings to the bigger picture. And I think it is a wonderful contribution to the fellowship program, and that the types of patients we care for here really give us a wide range of infectious diseases with a strong emphasis on the types of infections we see in the community. So hopefully we'll have a chance to show you more about Bayview, but for now, the video will have to suffice.